Good morning. I'm Eric Sario. Very sorry not to be with you today, but very grateful to Lani, Joby, Victoria, Rajesh, who I'm sure are going to uh, uh, work with you to have a great session. I just want to set the stage with this quick recorded presentation on basically why are we talking about strengthening systems for health at this Saving Newborn Life conference. I want to talk very briefly about emerging resources for HSS, which we have in our community and continue to build. And then I want to set the stage for our panelists with a little bit of discussion of systems thinking as a habit of the mind. First, why and what is health system strengthening about? Well, if you look at things like universal health coverage, the Sustainable Development Goals, etc., none of these ambitions can be achieved without strong, viable, responsive, and resilient health systems. It might be a vexing problem, but it is a necessity, especially over time. We can achieve a lot of things right now with a lot of resources, but over time, we know that it all depends on building viable, adaptable, resilient, and learning health systems. And we're going to try to talk a little bit about what this means. You've all seen these pictures of building blocks of WHO, and I don't want to spend a lot of time. It is just one representation of health system, and it has one purpose. It helped us know where to put some buckets of money, and some of us at Save the Children and other places think that it doesn't represent all the places where we should put money. And as you may know, there are dozens more, probably 40, 50 or more models and frameworks of the health system. So what I want to focus on this morning is how do you find out which framework fits your country program needs for newborn health and for the overarching purpose of building a reliable and strong system. So we need to think a bit differently about framework. Here's a quick illustration. Those are different maps or models or pictures, photography of the Pacific Ocean. And what one is the best framework? Well, you don't know. It depends what your application is going to be. It depends what you want to do. And one important thing to know is that the framework is not the system. The map is not the territory. So if we remember that, whenever we're talking about the building blocks or any other health system model, we'll be making progress. We don't want to think that our map is the territory, but we need to have good maps. Here's another picture. And if you think of the car as a system that allows you to go from A to B, this picture does not represent the system. That's very important to understand. Just listing all the pieces that need to be in a system does not describe the system. Actually, by definition, the system is more than the sum of the parts. And here what you have the picture of is all the parts. It is not more than the sum of the parts, it is exactly the sum of the parts. So again, to understand your system and to understand even your picture, your map, your framework of a system, you need to understand its context, the purpose of the map you're drawing, and the functions of the system you're trying to study. I think it's really important to remember that. So in Save US, we have a health system strengthening strategic orientation document, which we've shared with the global theme, and it's part of our discussions. It's not the Bible or the Quran or the Torah or any other document, but it starts with a vision about how we look at viable and resilient systems for health, what they're supposed to deliver, people-centered, universal health coverage of high quality, affordable, and comprehensive of packages, promotive, preventive, and curative services, starting with primary health care. And I think this conference has addressed that to a large extent in the previous days, even if the focus was newborn health. That's what it was about. And of course, systems for health, where Save the Children, we consider the contribution of gender, of education, poverty reduction, food security, and other social determinants to the production of health. And we consider the importance of governance, the inclusion of vulnerable groups, and what social accountability and community participation can mean. So this vision statement, which you might want to tweak, represents something important in understanding how we're going to view health systems. One of the most basic picture we can have a health system, here we don't have blocks, we have circles, It's to look at community actors and systems and healthcare actors and systems brought together and to produce health. And there's nothing wrong with the WHO definition of health. It's very comprehensive, very holistic. But in practice, when we spoke about health system, often we mean the right part of the picture, the healthcare actor and system, and we forget the left part and we forget the broader picture. I want to build a new framework for us, not that you have to adopt it, but one that tries to fit a little bit of our vision. So if we want healthy populations, healthy newborns, but healthy newborns with healthy mothers and healthy families, we need to have service delivery that's effective, quality, high coverage, accessible, etc., affordable. But we need to have household production of health. We know that's very important. And we need to have some positive effects or remedial effects on social determinants of health. We know that's part of our big picture. And we can draw a map. And to have services, you need a health workforce. And you need products and vaccines and technology. You need financing, otherwise it doesn't work. You need leadership, you need information. And what you have here, we've rebuilt our 6 building blocks. So we haven't lost anything. But in terms of our experience at Save the Children, we recognize that there might be something missing when we paint such a broad picture, and certainly in terms of the community health part. And if we look at the household production of health and the social determinants, we know that just the health workforce and the service that they can deliver, even if you include community health workers, might not address all these things. So maybe the map is not sufficient. And finally, we've learned a lot, and we're learning a lot about what purpose information has. Of course, it's connected to governance, but we think there are pieces about information that are critical to making the system viable and performing and responsive to the need of people. And some of it has to do with learning and accountability. So we want to draw a bit these community linkages and what's here. And here's a broader map, and that's borrowed from the Maternal and Child Survival Program, in which we're a partner. And it emphasizes that you need to have very specific services at the community level. And they are part of service delivery, but they require different ways of doing things. So we try to draw attention to that. And to do that, you need a different health workforce. You need trained community health workers. And we really want to see, yes, trained community health workers. And most likely, we're talking about paid community health workers that are part of a health workforce. But that's not all. Because we also deal with household production of health, we also want to affect the social determinants of health. Our community health colleagues and people that intervene in social behavior change, and also that try to build community capacity, build strengthens community systems, actually, whether it's through the community action cycle, whether it's through care groups, whether it's by bringing volunteers or women to support their neighbors and peers, we work through community organizations. And to do this at scale, we've learned to work through societal partners, which may be other NGOs, other members of civil society working with the Ministry of Health. These may be people working in other sectors, agriculture, education. And these are going to be key to this side of the equation. And finally, we need to have information used for learning and accountability. And accountability brings new elements. So again, this is just a framework. It's not good, it's not bad. The question is, can it be useful? And it may be that for some of your purposes, it is useful. And it might be that for others, you'll need to draw another map. But again, remember, it's a purpose, it's a functions that you want to see served. Here's the functions we want to see served. Our service delivery, household production of health, social determinants. And we're not saying all the things that go into this. The more you go in details, the more there's richness of the picture. But we want to see some things that are really important that are not always there. So here's a framework for systems for health that go beyond the building blocks. And again, we want to do other things. So when we talk about system strengthening, sometimes we focus on, does it work? And here's a picture of a diesel engine that runs an alarm clock. And it does work. Actually, this was awarded an Energy Star rating in a competition in the US. But this is not viable. This is not a long-term system. It does not fit anything. If you want an alarm clock, that's not the way you want to run it on your bedside table. So just because it works doesn't mean it fits. And the question of whether it fits and the parts make sense together is really key when you look at systems. So we want to learn to ask different questions when we are struggling with, are we strengthening the system? We're not just asking, do we have the pieces? It's important, it's essential. We're not asking, does it work? It's important, is essential. But we're trying to ask questions about, are we moving from supporting systems to strengthening system? And are we being very selective, or are we being very comprehensive? Of course, our newborn health colleagues are very interested in strengthening systems that protect and serve the need of the mother and the newborn. The integration of maternal and newborn health is a self-evidence from a health system strengthening perspective. It doesn't mean we do the same thing for everybody, but there's some question of integration. But also the broader question of, does it just work, or do we really move towards strengthening a system that can be viable and responsive? So how do we ask these questions? You've seen, I'm sure this week, this is a simplified picture of the pathway to high effective coverage and impact at scale, which Saving Newborn Lives has been using, and I'm sure you've seen different versions of that, and that's a great effort to map, the pieces that need to work together to get to the survival of the newborns. Very important. This slide has too much text, but there's different ways we can ask questions of our projects to learn about, if we're strengthening systems. And those just are attempts that are kind of a bit generic, but they can be tailored to your project needs. So I have to move quickly on this, but know that it exists. I just wanted to give a few minutes to give you a heads up on some resources that you have. Workplace community of practice, which you're invited to join. You see, we have now 78 members. I think it needs more members and more contributors because we can't all hang out in Jakarta all the time, as much as some of us wish we could do it. So this creates a space where we can raise questions, discuss. It's an internal space for discussion, experience sharing, and I hope you'll contribute. And thanks to Susanna Pritchard and Jill Burke from the Global Theme that really help animate this site. We have a OneNet page, and on this OneNet page, one of the resources that we have is a health system strengthening searchable resource database. It's Excel-based. You can search it by different criteria, and there's a form for you to give feedback on if you have new resources or how you like the resources that you found. Finally, we have a number of small initiatives underway. We have a paper clarifying our relationship to common approaches. I think it might be worth a read. We have some case studies underway, which early in 2018 we hope to have results about. We're trying to map better what we're doing for quality of care and what tools and experiences we can share across our programs. And I'm sure, I know that you've had good sessions on this in Jakarta. We're thinking about having short tutorials, but again, your feedback would be useful. And then a question which I hope Lani and our panelists will bring to you at the end. Are we using evaluation for health system strengthening? What are your plans? Evaluations is important to understand if we're doing health system strengthening, but it's also very important to bring health system strengthening to the fore and bring our stakeholders together. So I hope you'll think about that. Now, before I give the space to our panelists, I want to talk a little bit about system thinking. WHO published systems thinking. There's been a number of papers, supplements. This is a great introductory paper by David Peters here. And there's a lot that's being written about system strengthening. And what does it mean? Does it mean you're being holistic? Does it mean that you're addressing everything? Well, I won't give you a final answer for you today on what system thinking is, but I want to give you a trick. I want to give you a step forward. And we're going to hear from our three leaders, our three panelists, about their particular experience. But I want to use a trick, a habit of the mind, as David Peters say, to help you think about systems, to help you practice system thinking about. So here's a little bit of a confusing picture, but there's many ways to do system thinking tools, right? Some of us have used network tools, causal loop diagrams, systems dynamics, soft systems methods, participatory action research, all these things in some ways, as well as quantitative studies and mixed methods, can be part of system thinking. But the question is not just one tool, it's how do we think about it. So here's a trick a habit of the mind that you can try to use, and I invite you to use during the coming session as our panelists speak. Joby is going to speak about management and governance at different levels and improving that by better use of information. Victoria is going to speak about institutionalizing quality of care processes at different levels of the national health system. And Rajesh is going to speak about mobilizing new actors for effective health planning in urban context. So, for all of them, you're going to hear a little bit about boundaries decisions. Whichever part of the system you're talking about, you're probably not dealing with the whole system. You can never deal with the whole system altogether. Actually, nobody ever does. So you're going to have to draw boundaries. You're going to have to draw boundaries and boundaries within boundaries. Ask questions about what is in, what is out, and how far out is it, or how far in does it need to be in, and what is in the different element that should be there. And there are consequences to what's in and out. And you need to think about that. And then the other thing you need to think about is relationships. There are relationships between elements and structures. There are relationships between elements that are within the boundaries and elements that are outside. And both need to be considered in a different way. And I think you'll hear that from our panelists. You also need to think about relationships between people. And you also need to think about relationships between cause and effect, because you're affecting systems. And that's not all, because systems are made alive by people using tools and technology and building blocks and such. The perspective of these people is really essential to make sense of what choice you're making. There's some hard set measures of perspectives: adoption of kangaroo mother care, newborn mortality, immediate and exclusive breastfeeding. There's like objective perspectives of that. But a lot of more things change is complex and affects these relationships and these boundaries. And you need an interactive process between these different elements and perspectives of stakeholders inside and outside, and clients are really going to be key to see whether the change we're making is really making sense to internal stakeholders and clients. So you're going to go around in your brain about what are the boundaries, what are the relationships, what are the perspectives. Now that I've gone around, does it change how I need to set my boundaries? Does it change my perspectives? And this is a different way to think about our health systems work than just thinking of our input, output, outcome, impact, which is essential. But system thinking means a different way to use our brain. And I hope that the panelists will describe for you how they've gone about tackling some complex problems with the health systems in very different contexts, tackling very different problems. But I've asked them to kind of conclude a little bit or highlight a little bit how boundary decisions were made throughout, and what relationships they had to consider, and what perspectives were at play. And what I hope is that you try to play the game and see, does it help you see a map of the health system, a map of this territory a bit differently. And I think that can open a discussion for how we consider our programs. So I hope our panelists are going to bring it to something very concrete. And I really want to thank you for being here and participating in this session. And I hope you'll participate actively. And I'm looking forward to hearing the feedback from this session. Thank you very much.